Okay. So good afternoon, good evening. This is evening. I usually start off my meetings in so many time zones. I always give all the times, but my name is Armin Amatensian. I am the second vice president of NAMI Tri-Valley. I'd like to call myself Marcia's and Rosemary's right hand, everybody's right hand, helping out with the general meetings. Today, just like most of the meetings, we have a very interesting topic, very close and dear to all our hearts. We're going to bring to you a very special gentleman who's going to talk to us about the program that we've been waiting for a long time. Okay, so Binh Au is the crisis line program director. Now we just understand that he's even changed a job, so he'll talk more about that. Okay, the crisis support services of Alameda County. He identifies as a family member, caregiver, and lives in Oakland. One of ours local. Binh likes to dance, ride his bike, cook, and spend time with his family. We're going to learn today all about the 988, how it works. We know it's a national program and how it's implemented here locally. I hope you came with your questions. So as the presentation goes on, please start typing your questions on a sign in the chat, and we will have plenty of time to answer all your questions. But before we turn the floor to Binh, I'm going to have to turn the stage to Marcia McInnes, our NAMI Tri-Valley president, who will give us some updates and some relevant information that all of us need to know upcoming events. Marcia, you got the floor.
Thank you. So if there's anyone here, this is their first time to NAMI Tri-Valley, I want to thank you and welcome you. So again, I'm Marcia McInnes, and I'm the president of NAMI Tri-Valley, and I just would like to share some things that are ongoing over the many activities that we do. The first thing I'd like to announce is that coming up on Saturday, August 13th, from 9 in the morning until 4 o'clock in the afternoon, we will be holding our 8th suicide prevention workshop for family caregivers that we are partnering with NAMI, Alameda County, and Crisis Support Services of Alameda County. So we are extremely grateful to their support and their continued support over the years of us putting this on. The other I'd like to mention there again, we do have an office as of June 1st, and I'll put in the chat our address. However, if you want to meet any of us, it is by appointment only. We haven't really, it's so new, we haven't set a schedule yet. On who would be in if someone were to just drop by. So we're not doing drop-ins, but we are setting up appointments. And let's note that. I do also want to mention that next month we're inviting for our general meeting, and that would be the first Tuesday in September, sorry, wrong month. Dr. Jennifer Penny of Access Community Health, who's going to update us on the Access Bridge Urgent Mental Health Care Clinic and how they're doing, if they're, if this is going to be a permanent fixture. It was a year-long pilot. And as I understand, Eric Swalwell was managed to bring in $1 million toward this service. So that's great news to me. Also mentioned that family to family, the education classes, and who are teaching it, please correct me if I do not have this right. The next class is going to be September 10th. Question mark? Do I get? Okay, I got that. Starting on doing Saturday mornings. Those of you who are not aware of what family to family is, either put in the chat and we'll put that information in for everyone so they can see it. NAMI Connections. This is the peer support group. And this group, for the first time in 2.5 years, met in person in the conference room at our new office location. And if all goes well, our family support groups, we will split it, one Zoom and one live. So you folks that are here tonight that I've never met, I'm going to be unduly excited to meet you face to face should you want to come join us. That will be in September's 4th Monday night meeting. And then the last thing that I wanted to mention is that ongoing for many, many years, and I took a vacation here for a number of months, but we will be bringing back the Valley Council on Mental Health. It'll be in the same time slot every second Wednesday. Yes, every second Wednesday from 12:30 to 1:30, I believe. I'll have to, how easy we forget. So other than that, I'll hand this right back to Armine, and thank you.
Thank you, Marcia. And before we turn the floor to Ben, I just want to add one more thing. As you heard from Marcia, there's a lot going on with NAMI Tri-Valley. We bring all the services to our community, and we're starting to ask, and if those of you who are interested to join NAMI Tri-Valley, it's a click away. You can sign up as a member. And actually, I'm going to ask Lois to drop in our website where they can go, and all the registration is there to find out more about NAMI Tri-Valley. And to actually sign up as a member, you can join as a regular member, as a family, or an open door, which is really for people who have financial issues and cannot pay the regular price. So all is there. We're trying to keep our doors open. We're doing everything we can to bring whatever service is needed to the community. Any questions, feel free to type and ask. My name and number was on the flyer, or Marcia and all of us board members are on the website. So with that said, let's start talking about the topic of the day. 988, the new thing, the best thing after 911, I suppose. So I turn the floor to you, sir. Let's learn all about 988.
Hi, everyone. I am so grateful and humbled to be in community with you. I have really enjoyed working with Marcia closely over the last many years, and I'm inspired by everyone I meet at Tri-Valley NAMI. My name is Binh, and I was the Crisis Line Program Director probably for the last 10, 15 years. I started as a volunteer on the crisis hotline when I was a sophomore in college, and just stayed with the organization. And 20 years later, I'm still here. What drew me to the position, to the agency 20 years ago, is that living with mental health challenges was part of my story. My parents were refugees from Vietnam, and they came over in 1979, and they, suffered through the stress of immigration, moving to another country, fleeing a country. My birth mom had schizophrenia, and during the time of war, she did not have access to medication. Her paranoia was very awful. She endured a lot of suffering. When she came to the US, I was born. CPS took me out of the home because she wasn't well enough to take care of me. So I was adopted by my aunt and uncle, and I experienced firsthand just mental health stigma. We didn't talk about it, right? I knew that I was adopted, but I really didn't have any stories of my mother. We didn't talk about it. It was just not quite a secret, but we didn't have the words. Fast forward, I'm at the crisis hotline. I'm a volunteer. I'm a staff person. I turned 27, and I realized that I need to understand this piece of my history. So I went onto Facebook to look for my mom, and we haven't seen each other in close to 20 years. And I found her. I was able to reconnect, and it was incredible, reconnecting with a family member who was so stigmatized and ostracized from the whole family. Um, so I'm committed to the work because I want everyone. I never want I never want anyone to feel like they don't belong, right? That we are stronger as a community, that we need to be there for each other through the toughest times, through the hardest times. It's not okay just to put someone aside. Um, yeah. Okay, so today I prepared a handful of slides about 988, but truly I want this to be more like a town hall style of meeting where I invite you to ask questions. I want to know what you're most concerned about. I want to know what you're most curious about. I want to know, what are your questions? And I want to be able to answer them as best as I could. Um, so let's just dive into the presentation. And then as questions come up, feel free to raise your hand, type a question in the chat, or just blurt out loud. You can unmute. I think our team is small enough that you can just unmute and shout out your question. Well. Alrighty. Let me set up my screen a little bit better. Can everyone see my screen?
Yes,
I see two.
yes, we can.
Okay, perfect. Okay, so 988. Working in collaboration with Alameda County Behavioral Health, we have and multiple partners from EMT workers, fire department, police departments, all our mobile crisis team, peer family advocacy, FERC. We are coming together, right, with a shared vision. An Alameda County in which everyone in all of our diversity has ease of access to life-saving resource. That's what we're trying to accomplish. 988 is not a new service. It's a new number to access a service that's been around. So starting July 16th, the number was rolled out nationwide, and calls from the 925 and 510 and 341 area codes roll to crisis support services. We're here in Oakland, and the goal is that when you call that number, you talk to a compassionate counselor who's available 24/7 to support someone through mental health crisis. That could look like thoughts of suicide, mental health or substance use crisis. It could be other kinds of emotional distress, just life distress, right? People have been experiencing a lot of loneliness and sense of disconnection with COVID-19 and having to shelter in place, unemployment stress, relationship stress. We're happy to talk to people through things that are causing them stress. People who are worried about a loved one can also call 988 and get coaching or support or referrals. We're not here to give advice. I want to be really clear about that, but we truly believe that most people have the answers within them, right? Our goal more is to provide a safe space, a warm, inviting space for people to share their distress, and together we'll make a plan. We're not here to tell anyone what to do or how to live their life. We do believe in self-efficacy, self-determination. 988 is not 911, and I think this is something that we've had to clarify over the last couple of weeks. There are a lot of messaging that says like 988 is the new 911 for mental health crisis. That's not quite true. If it's a medical emergency, right, or a life-threatening emergency, or there's like violence involved, like domestic violence might be happening in the moment, then in those times, 911 would be the better place to call. We are encouraging people to call us before it becomes an emergency. So even like, I know many of the people in this meeting have loved ones, or you yourself might live with mental health struggles or challenges, reach out to 988 before, talk to one of our counselors before you were in crisis, so that you're able to understand how we work, build a connection. So in those moments when you are in crisis, you'll call and you know what to expect. Yeah, does that make sense?
Yeah.
Okay. So yeah, we are encouraging people to call us before it's an emergency. Just some background. Historically, the Lifeline has been around since 2005. Our agency's been around since 1966. And in 2005, the Lifeline was started with a toll-free number that you can reach anyone, any crisis center by calling that toll-free number. Here's a little map just to get a sense of where all those Lifeline centers are. And calls to the Lifeline are routed based on their area code. And I know there's a question about the routing and area code, so I wanted to clarify that. The system is not perfect. The area code routing is not perfect. We reached out to the National Lifeline, the people who are overseeing the technology piece, and they said in California, they try to match area code and zip code associated with that phone number to send them to the crisis center. But over the last 2 weeks in our experience, sometimes people call 988 and they wanted to get the Santa Clara Crisis Center, but they got us. Or they wanted to get the Walnut Creek Crisis Center and they got us. And so we do recommend knowing the local number of the crisis center in your area and then typing that into your phone. So instead of calling, so if you call 988 today, so this is actually good homework, call 988 today and find out where it routes to. You can just ask the person, what crisis center did they reach? And if they say Alameda County or Oakland, California, then you reach the right one. If they say another county, then on your phone, you should program our local number. And that's 1-800-309-2131. So yeah, I'd like for you to try. It's not a perfect system, so I can't promise that you'll get routed to the correct crisis center. But this is kind of the vision that we have nationally. The first horizon of creating a connected crisis continuum is having someone to talk to. So having 988 is a really important part of that, an easy to remember number. When I was a kid, right, I was taught at school, if there's a medical emergency or something's wrong and you need help, call 911. And as an adult, I know where to call. We're hoping that my kid's 6 years old now. We're hoping the next few years, maybe by the time that she's 10 years old, right, she'll know 988 is the number to call for mental health crisis. And that's a huge thing. It means that it's like pushing American society forward, that it's okay to ask for help. It's okay to have a mental health crisis, right? We live in a stressful world. We live in a world that puts so much pressure on people. It makes sense that people are experiencing crisis or depression or anxiety or even suicidal thoughts. And we say this on the phone. It makes sense that you're experiencing suicidal thoughts. It's a natural reaction to the stressful world that we live in. And it's okay to ask for help, and we're here to provide you support. So just being able to normalize asking for help and knowing where to get that help. Now, are we prepared to meet the needs of every person in the community? The answer is no. We are still woefully underfunded. We still rely on family members like yourself to take care of loved ones. Yeah, there's still a long ways to go. And so continuing your work to advocate for more funding, for more programs. As a nation, we hope that 988 will put the pressure on local governments and state governments and federal governments to have the funding to provide, to build out these programs, but currently there's not enough care for everyone. That is the truth. If you call us, right, we have been experiencing high call volume, and to be honest, we are working to build out our team. And so you might experience wait time when you call 988 or our local crisis lines. I want to give you very realistic expectations. If you do hear like hold music, you might hear my voice saying, we apologize for the long wait. Please stay on the line. I encourage you to stay on hold until you get connected. I'm happy to share my email address as well. And so if you do ever experience a problem with the crisis line service, you'd have a direct access to talk to me about it. So anyways, that's Horizon 1. If we can get to this point by 2023, that 90% of our calls are answered, then that's our goal. Horizon 2 is that we build out our mobile crisis system, right? That someone will respond. There will be someone available to respond. So the goal with that 80% of folks asking for mobile crisis response will get a response by 2025. And then Horizon 3 is that there are enough crisis stabilization centers, a safe place for help, that people can go somewhere. Historically, when people are experiencing mental health or suicidal crisis, the response has been surveillance and incarceration. Either you go to jail or you go to the hospital. And going to the hospital, for many people, it's not a pleasant experience. The hospital takes away your phone, takes away your ability to call your friends or like watch Netflix. If you think about a person in crisis and you're trying to get better, right? That person needs a place of respite, somewhere where they can relax, somewhere where they can take care of themselves, connect with other people.
Katie,
Yeah.
Bologna I hit on top.
Oh,
Sorry about
don't have a question? No. And so building out more appropriate crisis stabilization centers, and I can share information about what some of those are today in our presentation, and I'd be happy to answer your questions about those. So we currently have some, and I would love for you to know about them. But still, we're still a ways away from having enough services. So I think you've already met Assembly Member Rebecca Bauer Cahan, who wrote the AB 988. It's a law that they're voting on this month, to try to get passed. And it'll create stable funding for 988. So currently, the resources that we have to build infrastructure and to hire staff to answer our crisis hotline is from Gavin Newsom's budget. It's through the budgetary process. So Gavin Newsom wrote $20 million into his budget to support crisis centers throughout California. There's 13 of us. But that funding is not ongoing. So AB 988 will create some kind of tax on telephone services to help continue the funding. So this is a place of advocacy where people can advocate for. And here are some of the hopes of 988. Collaboration between all parts of the crisis system. Crisis lines having the ability to dispatch the mobile team. So that is something that we're actively working towards, is instead of calling 911, which is the route for most mobile teams right now, that if you call 988, that I have a backdoor number or a cell phone number to call for a request for a mobile team. So we're working on building those relationships and protocols. We're not quite there yet. That we would have access to knowing which beds were available and which crisis stabilization centers were open at this time. Once again, we don't have that set up. Knowing when and which mobile crisis teams are open. That's probably one of the bigger critiques of our mobile crisis team, right? There isn't one that's willing to go out to Livermore and your neighborhoods. And yeah, we need more of those services. And then we've been building out protocols and MOUs with our local 911 call centers throughout Alameda County, so that if there is a mental health crisis that is not a medical emergency and not a violent situation, that they transfer those calls over to us. Our counselors are available and have the spaciousness of providing mental health support, counseling over the phone that the dispatchers don't have the time to. And we're hoping that that supports reducing the use of law enforcement visiting someone, right? So if they're able to transfer the calls to us, we're able to dispatch mobile team or help the person go to a crisis clinic. That's one law enforcement officer going to someone's house. And we know that in our community, there's people have different experiences and trauma experiences related to law enforcement. Law enforcement have a lot of power. They carry a gun, they can take your things, they can put you in handcuffs, and in some cases, they have shot our community members dead. And so a lot of our community members are nervous about interfacing with law enforcement for very, very good reasons. So we are working closely with the police, right? I do believe they're good people and they want a safe community and they're busy. And so like, how do we like connect people to the right, how do we connect people to the right people? So that's our goal with diverting calls from 911 to 988. And then like more robust data collection, not with the goal of surveillance, not for surveillance reasons, but truly understanding what our needs are, who's getting help, who's not getting help, and how do we create systems to help make sure that everyone has access to the right kind of help. So that's our vision at the statewide level, as written in that law, as well as the vision that we're trying to carry out here. There's still lots of growing to do. So what can you expect when you call 988? I can share what, from our perspective, but after I share, I'd love to hear from your perspective. What has happened when you tried calling 988 or calling our crisis lines? When you call 988, the call is routed to the National Suicide Prevention Lifeline. They've changed their name. It's now called 988 Crisis and Suicide Lifeline. Their office is like in New York, and they have the technology to route calls based on area code. So you'll hear sounds, you'll hear a greeting while they're routing the call back here to Oakland. You'll have two options. You can press 1 for the Veterans Crisis Line or press 2 for the Spanish Lifeline. So for folks who are Spanish speaking and would prefer to speak in Spanish, you can press 2 after calling 988. You'll listen to music while you're getting connected to us. And then in an ideal world, a counselor in our office or working remotely will pick up the phone and they'll say, 988 Lifeline, this is Binh, how can I help you? And the goal of that person is to really hear and understand what you're going through. And then if needed, provide coaching to help a family member. And if the person's in active suicide crisis, right, support the person in figuring out a safety plan to help them live through the day, live through the night. So I'm curious, I'd love to open the floor to folks here. I'm curious to hear what are people's experience when you've tried calling.
I can start by my experience. I did call and I'm a 408 area code. So I ended up in Santa Clara, but figured out they gave me a number to call. And I think that the lady I spoke with, she was working from home and it was interesting. I found out that everyone is learning as we go. So I was understanding at the time, it was just testing the system, but I've learned that I need to put the number on my phone.
Mhm.
And everybody, or especially anyone and NAMI members, it is good idea to check out and the services so that when you call, you know what to expect.
Mhm. Yeah. Anyone else want to
Yes,
share?
yes. I actually, the day before the national rollout, I had spoken with Nurgis Dillon, the executive director for crisis support services, and I had a concern about 988 at the time because I had learned that 925 could easily be routed to Contra Costa. My worry was that, did they have the right information? If they're telling me to go to Martinez and I don't live in that county, that might be one more thing to think about when you don't want to think about any of this. You want help. And so she did a little bit of groundwork and did get back with me. But one of the things that she suggested was, well, try it. So I did. And it was fairly fast. It did the music part and the, a little bit of phone tree, but nothing, that was, it was actually quite easy. And someone picked up right away, and I identified myself as NAMI Tri-Valley and asked, where was I calling? And she said, what county? And she said, Alameda.
Mm.
So, either I got lucky that time or, I mean, I guess kind of my question is still, should we be asking where we're calling if we're using the 988 and we're 925 area code? Is that a good idea? Does it matter?
That can help. That can help. One of their goals as a crisis center community is to connect people into their local crisis center. So yeah, the person who is in Oakland will better know the resources that are in Oakland. So in Oakland, Alameda County.
Thank you.
Yeah. So it's helpful to ask them. And you can share too. You can share what city you're calling from.
Yeah, so, and I did. And so it works, but I think we need to do it in just one little extra step and at least to figure out where we're at when someone does pick up the phone on the Lifeline side. So we'll try to educate here.
And the other piece is you can give, so these conversations are really helpful because it helps us create our marketing materials. We haven't made posters or business cards, because we didn't know exactly what we wanted to say and what you can realistically expect. But we've decided that our marketing materials will say like 988, right, to reach the Lifeline, but also our local number. So if you have an area code that's not 510 or 341, or it's 925, call our 10-digit number directly. That would be the best. Then you know for sure you're reaching Alameda County, our crisis support services of Alameda County. Mhm.
But the thing is, this is being rolled out nationally as the answer. I still worry about it because not everyone's gonna know that. And so I'm not sure how to convey that to the general public, that this is great, this is wonderful, we've been waiting for this. I know I have. And but then just sort of, oh, we're not 510 or what was it, 341 or 3, anyway,
341.
not us. Why, where are we going? So I just, and as you well know, we certainly have a very deep focus on suicide prevention out here. It's it's a problem everywhere, but it's really quite concerning out here. So we have our work cut out for us.
Yeah.
So do you have the number for the 10-digit number?
Yes.
Or
Yeah.
Alameda County.
Yeah. Let me type it in the chat. All my Zoom stuff have disappeared. Can someone else type it in the chat if I read it out loud?
Mm-hmm.
Okay, it's 1-800-309-2131. Perfect. Thanks, Paul. Thanks, Lois.
I think one of the things that we need to emphasize, that at least I needed to hear, that 988 is not just suicide prevention, it's crisis, right? And like you said, a lot of people don't understand that if they're really feeling bad, they can call that number. They don't have to have a diagnosis, or they don't. As NAMI ambassadors, we can talk to the community. We can say those things. A lot of people are lonely and they don't know. My question is, as the calls coming in, there are certain times they're busy. Do you keep track of the historical use of I don't know if are they recorded, the conversations?
No, great question. We do not record our calls.
Okay.
When you call the lifeline, you might hear you will hear a greeting at the national level. Your calls may be recorded or monitored for training purposes. California, it's illegal to record calls, so we don't. We might have our teammates listening in to each other's calls, right, to provide support or for training purposes. So no one on our team is ever alone when answering the calls.
Well, that's interesting, because I believe 911, I don't even know if it's recorded or not, but they can go back to, right? This could be some life-threatening information. So at some point, all the calls are recorded. They can actually, somebody go back and track it, right? Is that the case or no?
Not for us. No one, no. That
Okay.
would not, yeah.
So that will be interesting, something to mention in the marketing. To me, that's important. If I'm calling and I'm going to be vulnerable, it's good to know that it's not recorded.
Yeah.
And then it's called Crisis and Suicide Hotline or Lifeline now, or what?
Yeah. Lifeline.
Yeah, okay.
So Ben, would it be possible for the people that answer the crisis line to actually say, you've reached Oakland or you've reached Alameda County, something that would maybe, and the other areas doing the same thing, like maybe they identify that you've reached Contra Costa County, it's like, I don't want Contra Costa County, it's like,
Yeah.
because if you're in crisis or concerned, you may not think, you just like, I'm just going to talk to this person. I don't know,
Yeah.
So I'm just wondering if it could be a two-way street kind of thing.
That's a really great idea. Let's see.
Yeah, they should just say right off the bat what county it is.
Would you feel weird if it was a recording that said it? It would probably be my voice or Jessica's voice saying,
No, that'd probably be fine. Just
County.
anything, that identifies that, and then you can say, oh, that's not the right one. And so,
That's
but I don't know if someone were in crisis, if they would call a different number.
Yeah.
As opposed to a warm body. So it's something to think about, maybe.
I love that suggestion. I think that could make
Thank
things a
you.
little bit right. Anything we can do to make it a little bit easier for folks reaching out. We're all about like reducing barriers to care.
Yeah.
Right. And so like if people knew which crisis line they were reaching, and they would feel more comfortable talking to their local one.
Yeah.
That sounds great. I'll follow up on that. These are wonderful questions.
I was thinking about another idea on top of what the last person was saying. that if someone realizes that it's the wrong, they're wanting Contra Costa, but they're in Alameda, they
Mhm.
can, maybe they're on the recording, or someone could come on and give the Contra Costa number, or whichever ones are close.
Yes.
But we wouldn't want the recording too loud because too long, because then people are going to hang up.
That's true. Yeah, we've coached all our counselors to have access to give the phone number to our local Bay Area crisis centers, because that's
Mhm.
probably where the majority of the mix-ups would be.
Right.
Yeah.
Are your counselors able to transfer the person directly so that the caller doesn't have to, re-enter another phone call if they're really agitated or whatever?
Yes. The answer is yes. We can transfer. We can do a warm transfer.
Mhm.
I think every crisis line in America is committed to like staying on the phone with the person. So like if the person is agitated, upset, we'll stay on the phone to hear and understand what's going on. So yeah, and part of like we have the structure of the call where we build rapport, we assess for safety concerns, we ask questions, about people's suicidal experiences and other safety concerns. We get the story. We found that for so many people, if you just get a chance to tell your story, right? What led you to feel this way? What's happened? What happened today to lead you to want to die by suicide? Get people to tell their story. People feel better by the end of that. If more is needed, then we'll do collaborative problem solving. And part of collaborative problem solving is figuring out what the next steps are. So part of the next steps could be the next time you're in crisis or the next time you need to reach out, call, Contra Cross the crisis center. Here's their number. So yeah,
Okay.
we will stay on the phone if the person is in distress. I think people who choose to volunteer or work here, they're committed to being present for folks who need us.
So the operators are volunteers or they're actually working for?
Yeah. Let's see. We have currently about a team of 100 volunteers.
Okay.
They work 4-hour shifts, and some volunteers are artists, others are musicians or lawyers, financial people. We have college students who are looking to start grad school. So all kinds of people answer the phones. We also have a team of about 30 people who are paid staff people, both paid phone counselors, and paid shift supervisors. And part of our equity work more recently is to create a paid position for phone counseling, because we wanted to create jobs and opportunities for folks, good paying jobs to answer the crisis lines. Folks who may not have access to flexible schedule, people that might have lived experience of mental challenges, or people formerly incarcerated. We're looking for a wide range of life experiences that we believe will help improve our capacity in responding to calls and crises.
So you must have a training program, right? Because they're volunteers, they come from all walks of life, and sometimes it's not the easiest thing to talk to someone who's suicidal or manic on the other side. There's a whole range in the middle, but this top 20% and the bottom 20%, it's going to get tricky.
Mm-hmm. Mm-hmm.
Do they-
Absolutely. Yeah. We go through about, I want to say like 90 hours of training. So volunteers, they dedicate 3 whole weekends to crisis line training from 9 to 4, Saturday, Sunday. And then in between those weekend classes, they're doing 2-hour shadow shifts. Every crisis line shift that we have has a shift supervisor who's there available for answering questions and providing support. The training includes like active listening skills and suicide assessment and intervention, resources in our community, working with a diverse population, culture, humility. So
Okay.
yeah.
So with COVID and working from home, how does that come together? Because the young lady I spoke with, I knew she wasn't like a professional in the field
Mhm.
right away, but she was, very sympathetic and all. And she was, taking my call from home. So if they're from home, how did I get the backup?
Yes. Well, part of my job as the director and my new job as operations officer is I try to find the best technology for us to do the work. And so we have the best phone system. Um, if you want to know the details, it's called dialpad.com. And it has tools in there that includes video conferencing, chat, so we can stay connected using text messages. We have supervisory tools so that if someone was on the phone, right, I can listen in and provide coaching and support. So there are ways that we still stay
Good.
together and stay connected. It's not quite the same as us all being in the same room,
Right,
and we
right,
can just
right.
turn around and look at each other. But as COVID is getting better, we are encouraging people to come into the office. But for now, we needed to prioritize safety, and I found the best phone technology to make sure that people could do the job safely, stay connected, still get the help they needed.
That's great. That's important because if the operator or whoever's trying to help out feels overwhelmed, they can push of a button, get some help into the line, right? That's what I'm after. Okay.
Exactly.
Okay.
I have a question. Ben, what's the relationship? Do you have a good, strong, or CSS have a good, strong relationship with Access Bridge, mental health urgent care?
Mm.
Do you collaborate or do you talk at all? Or
Yes, yes. We answer the phones after hours for the access line. And so we stay pretty connected on a daily basis. Yeah, we go to monthly meetings together. And we've been working closely too with Stephanie Lewis, who is overseeing all of crisis services. So that's another way that we stay connected to the county services. Yeah. Let's see. I love all your questions. There was something I wanted to demo before I stopped. Oh, here's like
Actually, before you move
Yes,
on, I'd like to
yes.
go back to the volunteers. I heard you had mentioned the different volunteers that they came from all walks of life. Artists, musicians, lawyers, etc., etc. Are these volunteers in the state of California, or are they all over the country?
They're all in California.
All of them are in California.
Mhm.
Okay. And then for some reason I couldn't see everyone on the screen. I tried for the last 15-20 minutes to get back. How can I get back? I couldn't see all the friends. Oh, here we go.
When we share a screen, you cannot see the faces. That's basically what happens. And it depends how it's set up, vertical, horizontal, or, it changes. It's custom.
Okay. No wonder for the last 20 minutes I couldn't try. I tried, but then, okay, now I got it. I myself is a caretaker for my brother. I have a brother who is mentally disabled, but the reason I come to this meeting tonight, I know Marsha, I know you invite family caregiver to attend, and I saw your email yesterday. So this informations are new for me. The 988 sounds really interesting. I need to do more reading and research and learn more about the organizations. I lived here in Castro Valley. I have loved one who lived in San Leandro, and I know Marsha, you had done a phenomenal job, so faithful and organizing the group, right? and the family supports and different members. And I know the office is located in Livermore. It's such a distance drive, but then now that I learned 988 is nearby, most likely I'll give that a try too. But then there is NAMI. This NAMI in Dublin. This is interesting. So it will take me some time to
Did you have a question?
like how.
While we waiting, go ahead if you have a question. Okay, so while we're waiting, there is a question on the chat. It says, is texting a part of the 988 system?
Short answer is yes. You can text 988. You can try it now. It will go to a national center, right? And it'll get distributed to whoever is available nationwide. So it's not guaranteed that it'll come to the local center. The 13 Crisis Center in California, we want to create a California 988 system so that if you do text 988, it'll come to the California one. So at least you know someone in California is answering. But for now, it goes to a nationwide center, and whoever is available nationwide will answer it.
So that said, how much of your funding is coming from national versus California versus local?
Great question. I don't have those numbers off the top of my head, but I'm happy to email you back.
Okay. But I just like a big broad, big brush, like third of it is national. Does national cough out some money to you, or is just they provide infrastructure?
Not really. It's mostly the Gavin Newsom and our local county. And we provide multiple services. So we not only provide the crisis line and text line, we also provide outpatient services, support groups, and we have a whole community education department that goes out to educate the community. So yeah, the county is probably one of our biggest funders for all our services.
And you were there with the county before 988. That's what you were saying. So counties, it's using existing program to extend to 988.
Exactly.
I did have a lot of people talk to me, including my husband, when every time he hears public radio, they're talking about 988 and pick up the phone. So 988 is being talked about in news media quite a bit. And I think if anything, COVID is helping us, because 988 is for general public, not just serious mental illness or suicidal. Okay.
That is correct. We're hoping to connect with people who may never have thought about calling. Yeah. And
How
on
about
the
schools and high schools and universities?
So yes, we'll continue to connect and outreach to those schools. I think currently either high schools and middle schools, on the back of their student ID is the crisis line number and crisis text line, like our number, for most schools in Alameda County. So that's really cool. Yeah. Oh yes, I see someone on their iPhone raising their hands.
Oh yes, this is me. I'm Tui. So prior to 988, I heard of NAMI Tri-Valley, NAMI National Alliance Mental Illness. So 988 is NAMI is providing service for all over the county, for all over, include counties, states, and nationwide, right? But the 988 is only within Alameda or in this region.
Oh, Marcia could describe how NAMI works, and then I could describe how 988 works.
Sure, I can go ahead. So Tui, the NAMI affiliates, well, let's just say a majority of them in California, there's usually only one per county, or most counties. with a few exceptions, LA being one, Alameda County being another, where there are more than one affiliate. So there's NAMI, the NAMI Alameda County and NAMI East Bay, and I guess there's a I don't know what you would want to call it, but there's another one, and then there's NAMI Tri-Valley. So we just are based in geographic areas. And for us, it's Livermore, Dublin, Pleasanton is a primary area that we serve, but of course everyone is welcome and from anywhere. So we have a lot of folks, Castro Valley and San Ramon. So we're here for anyone who wants us to be there for them. And so the 988 is a whole different, we have nothing to do with that. Okay. We do the support groups and do workshops and educational outreach, that kind of thing, and talk one-on-one like you did when you called me that one night, and we must have spent an hour and a half on the phone. And so that's what we do. But we are not at all involved with 988 any more than you would be. We would call it just as anyone else in the United States. Only thing is California is set up a little differently from other states. How'd I do, Ben?
Great.
Yeah?
Expert.
Okay.
you.
So I want to
Good
make sure-
answer.
separate those. NAMI has nothing to do with 988.
And I
Thank
think
you.
something that we would like to continue to do more of is to stay connected, right? That we get to know each other, you see our faces, for you to meet some of our counselors even, and that all the service providers meet together regularly to hear like what's working, what's not working, how can we support each other in our work so that we can build a safer community. So we're separate, but working together and continuing to work together. Question, who, I don't know your name, but you want to just unmute?
Donna is over.
Donna, okay. Oh, you have to unmute.
Donna?
There we go. Can you hear me now?
Yes.
Okay. So first, Ben, I want to just thank you. About 2 years ago, I feel like I had the pleasure to talk with you for about an hour regarding our loved one who lives with us. And you were just like now, very supportive and caring, and I thank you. My question has to do more with my wanting to make sure I understand 988, in that we have had times where I've had to call the crisis mobile team. And then I've talked to the team, and they've talked about whether they should come out or not. But recently the local police came out because our loved one who's resistant to help and is unmedicated was raging and in bad shape. So the police called them, and they felt that was in order. And they came out, and it was about an hour and a half later. And unfortunately, whatever, by that time, things were calm. So there was no change. But my question is, if this happens again, because my husband and I are older and we live with this situation that is extremely challenging, would you suggest we call 988 or we call crisis mobile team directly through that number, or what, or the police? I mean, I'm trying to understand where the 988 would fit in for us. Great
question. This is a great question. Like, when is it appropriate to call which line, right?
Yeah.
And it's 3 levels of crisis. 988 is a phone counselor, someone like me, to provide the care. And we're going to do most of our interventions on the phone. The mobile team, if you believe having people show up at your house to do that evaluation and de-escalation in person is effective, call the mobile team directly. If it's a violent emergency where the person can't control his body, where your loved one can't control his body, then at that point it probably is a 911 call. Because I won't be able to talk to him over the phone to de-escalate. The mobile team might be able to, if the mobile team has visited, maybe it's a familiar face, a familiar voice, just seeing someone that they recognize can calm your loved one down. So yeah, the mobile team or 911.
I understand that.
Yeah.
Thank you.
At the end of the
Do you mind,
day,
sorry, follow-up question. Do you mind sharing what city and which mobile team are you calling? What city?
Me?
Yeah, what city do you live in?
Oh, we live in Pleasanton.
Pleasanton, and you were calling Pleasanton police?
I decided at the minute, I was toying with, do I call Crisis Mobile? Do I call the police? I called the police and they called. They decided to call Crisis Mobile Team.
Great.
And they stayed with us. My husband and I were not near the house. And they stayed with us, the police, for, an hour and a half more, almost 2 hours.
And they stayed away from the house also when the team came to go in the house. They didn't go in with them at all.
So anyway, that was it. I just want to know, make sure I got it. So 988 is more for counseling, but to get a quicker response, I guess we're going to have to do what we've done before and either call directly Crisis Mobile or call the police.
Yes.
Okay,
Yes.
got it.
That is the system working well, because if we call 911 and they believe it's a mental health crisis, like you told them, and they send the mobile team, that is ideal.
Okay.
Yeah.
I have a follow-up question for her. Since you were in Pleasanton, was this the Pleasanton Crisis Mobile Team that they're trying to get started, or was it the county one?
Good point. There are actually 2 people who work in the Pleasanton Police Department who are trained. They actually work with the homeless and then these situations. But when I called, they had gone already. They're only there until 5, but they were not there. It was 4:30, so I missed them. So this was the regular regular crisis trained police, but not the specialists that you're referring to. There's 2 of those, but we didn't get them.
So when you say Crisis Mobile Team, it's not the one that's through the county?
Right, I'm talking about the county.
Probably
Or
so.
you're talking about Pleasanton, the city of Pleasanton Police?
Yes, they called the county, the Pleasanton.
Rosemary, excuse me, I don't think they're quite set up yet.
Well, that's what I was wondering. I didn't think Pleasanton was said, but then on the other hand, I didn't think the county team came to the Tri-Valley.
Oh, yeah.
Crisis basis. So you're saying that they did respond.
They did. And I had talked a few months ago with 2 Crisis Mobile Team members. They called me and I had a conference call with them. And they were determining, what's going to happen. They come out, is anything going to happen or not? And they would have readily come. So there's 2 police officers. I know one who gave me her email, and it's just their hours are like Tuesday through Friday, and they haven't totally come up yet, as you said, but those 2 are working.
One thing on the procedure too is they didn't talk with us before they went into the house. We're not in the house. They knocked on the door. We're not talking about the police. I'm talking about the mobile crisis team. And they didn't ask us. They didn't stop to talk with us first to find out what was happening or what happened.
They were in touch with the police the whole time though. So, and we talked to the police, so maybe that's why.
But nobody wanted to really hear our story until afterward.
Yeah.
Do you wish that they had checked in with you before going inside the house?
They didn't.
They did not. It was a crisis trained EMT and a social worker.
So you're probably referring to the CAT team, which has expanded its hours.
Yes.
Okay.
And that's, most of the 911 call centers have been reaching out to the CAT team for that kind of response. To have an EMT person and a social worker or clinician.
It's kind of important though, if you can kind of say something maybe, because if they talk to us, because it takes, if it was on a Thursday at 4:30, there's traffic. And, the county team's trying to come to us. And by then, our loved one calmed himself down. And so everything that we had gone through, you know,
And I even had a
Yeah.
recording of
Um,
him
yeah.
yelling and screaming at Donna.
That's really scary for you to live
It is
through
very,
that.
this is what's happening to us. So, yeah, but thank you for your time always.
Well, we have to be there for each other. And thank you for sharing your story, because I think multiple people here, right, probably have experienced very similar things, including myself.
Yeah,
So
thank you.
you're not alone.
Thank you.
How is your son doing now? And would your son be willing to talk when he's
So,
out of
We're trying to determine if IHOT again would be a good way to go. And I'm in touch with, you know, support group. I'm in 3 support groups. I'm in touch with the county support group with, that's IHOT run. And we're trying to determine, is it worth it? We cannot communicate with him because he's delusional, paranoid, and push back at everything. So we're trying to, is it worth it for them to come out? We don't have many ways to go with this.
Mhm.
And he's not getting better. He's getting worse, actually. So,
Yeah, that's very discouraging.
Mhm.
He does a lot of projecting
Mhm.
way things should be that really apply to him,
Mhm.
less to us.
yeah. And like I said, not medicated enough.
It's
So
not medicated for
no help,
his mental illness.
no help.
No,
How
he
old?
doesn't have a therapist either.
35.
Mhm.
And is this new or it's been going on a while?
No, been going on.
Yeah, for quite a while.
Yeah, he's 6 hospitalizations in 4 years. So we know it's a lot, not many options. But thank you. This helps to
Yeah.
know. We really support, we love NAMI and all the support we can get. So thank you.
Yeah,
So Donna,
Mhm.
when was it that we first met at Pete's in Dublin? I can't even-
2008, Marcia was my first contact to get help, my first support. Yeah,
Mine too. We need to start a club. Who's
Yeah, the Marcia Club.
Marcia's support.
the Marcia Club.
Wow, so you go way before me, 2008,
Yeah.
2014.
An oldie.
we've been through the cycle where he improved under medication and with
Yeah,
Professional help.
then it isn't because, you know,
Then-
loses awareness, all that.
Yeah,
Everybody knows, so.
Let's see.
Yes, unfortunately, we can relate. So any other questions? Any other questions 988 related? For Binh?
Mhm.
Go ahead.
please.
Okay.
Yes, I learned about 998. It first began, I saw the date was July 16th of this year.
Mhm.
Mhm.
The phone number rolled out this year.
Mm.
But our crisis center has been around since 1966.
Wow.
So it's the same place that's answering the phone.
Mm.
Yeah. When you call 988, it'll reach to our counselors.
Mm.
In an ideal situation, if you have a 510 number.
What if I do not have a 510 number. My number is 925 number.
Mhm.
Would that route me to the 988?
You'll have to test it to know. And so so you can test it by calling 988 and ask the counselor what city they are in or what county they are in, and then you'll know. The other thing you can do is program our direct phone number, 1-800-309-2131. And it's here in the chat. Put it in there again. And that way you'll know you'll always get the Alameda County crisis line. Mhm.
1-800-309-2131. If I
Mhm.
put that in my phone and
Yeah.
program that and call,
Yeah.
it will direct me to Alameda.
Mhm.
Thank you.
Yeah.
And then I'm here tonight because I have been, as of July 1st, I decided to volunteer myself and care for my own brother.
Yeah.
He as an authorized representative for him. But prior to that, I'm a registered in-home support services with the county. The first county was Sacramento County. The second county was Contra Costa County, and now I'm in Alameda, where my loved one is residing. And he had gone through so many episodes that my family. I know, Marsha, I shared this with you about a year and a half or so ago. That evening, I drove home from after my work, and I had so much on my mind, and I feel the need to speak to feel the need to reach out to Marsha because a case manager here in Alameda referred me to Tri-Valley NAMI and with Marsha's phone number, and I was so grateful. I spoke to Marsha then. Ever since this family, this support groups exist, I continue to come to the support group because the importance of having to see Marsha had been there for me. So I hope to, yes, I cannot commit 100% as yet because I'm only 2 semesters away from graduating. And so if everything go accordingly, this should be done by next May. And the next 2 semesters will be very critical. And I'm trying to pour all my efforts and energy into these classes. And doing that, I decided in the meantime to continue to care for my brother and then come to the support. And so thank you very much, Marsha. Thank you, NAMI. Thank you, the different friends who participate or come and visit and join tonight. I can only share my experience with my brother. I'm very grateful. He always turned back and said, "I'm so grateful for my sister and my mom and dad, my family. But we, our loved ones need our patience and our love, and continue to come to the family support group, to this support groups, continue to help me to exercise patience and more compassionate and more sympathetic."
Hope you give yourself compassion. Twee, you're holding so much, kind of graduate and taking on the responsibility, taking care of your brother. That's incredible. And I'm
Yeah,
grateful.
my brother have 2 older sisters and 3 younger siblings. There are 6 of us in the family, and so 3 of them are 2 are married and 1 are engaged, and the younger sisters is she worked full time, so I'm the only soul who's nearby. And
Mhm.
so
That's a lot.
mm,
That is a lot.
but I'm so grateful for all the staff who are on tonight and on a monthly basis. You're not alone. I myself go through, and I witnessed my brother go through different episodes that he performed for all of us. And my mom and dad always tell me, and my other brother and other sisters, that what will we do without all you kids? So here I'm at the meeting, I'm listening, and I'm taking in as much as I can, and then bring it back to family.
Yes, I'm
good.
glad you're here. I have one more resource to show. Let's see. I wanted to make sure that you know about our new website. It's 988alamedacounty.org.
Oh,
And it's not perfect because literally I built this the week before launch date. So if anyone here on the call have like web experience and would like to support me in web design, I'm happy to take your help. But for the time being, I lost my chat. Here's the link. Easy to remember, 988alamedacounty.org. And I organized it in that way of like someone to talk to, someone to respond, and a safe place for help. Here you can meet some of the counselors and then help for a loved one, how to help a suicidal loved one. But the someone to talk, if you click on that, it'll have a lot of the frequently asked questions and what to expect. So you're welcome to find information here about our line. And then the other really important thing that I want you to know about is someone to respond, the mobile crisis team. There is a search tool here where you can search by city, what services are available. So, we were talking about Pleasanton earlier. So I clicked on Pleasanton, and then you can see there's the mobile crisis team that's run through the county, and the CAT team are available. And the hours are here. And if you push the plus button, you can read a little bit more. So what Donna was describing, an EMT worker and a social worker, that was probably the CAT team. So this is,
Do they
yeah,
also go out to Livermore? Or
yeah, that is the plan.
Pleasanton's right over the hill, but we're like another 10, 12 miles of congested freeway from there.
Yeah, they, I think their limitation is it depends on where the 911 call center. They have to stay within 30 minutes of the 911 call center. So I think, so I can't say for sure yes or no, but still reach out. Yeah, go ahead.
I can, and yes, the mobile crisis, county mobile crisis has come to Livermore. Yeah.
Mhm.
But that's not this, okay, the mobile crisis. And then how about that CAT team?
No, CAT is, oh, maybe they are, but I think they've gone to Dublin once as far as a county program, but Pleasanton has adopted the CAT model only for Pleasanton. Apparently Dublin and Livermore was not interested, and that's too bad. I'm going to have to find out why.
Let me see.
So Marcia, you said that mobile crisis came to Livermore. Was it certain times of the day? Is it 9
I
to
don't know. That's
4 or
the
5?
thing. I need that information.
The
So which one had the 30-minute time limit? Was that the CAT or the mobile crisis?
so yeah, erase what I said. CAT team is willing to go out to Livermore.
CAT.
Mhm.
Is or isn't?
They have to. We're part of the county.
Well,
They
but
have to. Yeah.
we pay for it.
so I would think mobile crisis would need to as well, right?
Yes.
Their hours are a little bit more limited. So that might be the limitations because they're only open till 6 p.m. On Monday, Tuesday, Thursday, and Friday, while the CAT team is open 7 days a week, 7 a.m. to 11 p.m.
Well, I like the way you've put this all on your website and where you can access it by city.
And as we get more information from each of the mobile teams, we'll update this. And then the different crisis clinics are available here too, a safe place for help. So little descriptions. I think the closest one to where you're all are at is probably Hayward. But
Now their backs.
yeah, Sally's place.
Yeah. Marcia, maybe this website should be linked to our, we should have a link at this. On
Yeah,
our
we
website.
could talk about that
Yeah,
later.
yeah. We're in the process of revising our website, but haven't gotten too far yet.
Yeah, we just needed a place to give this information because the crisis system is continuing to grow and to improve itself. Thanks very much to your advocacy. And And so we wanted to have a space to give you that information in a timely basis.
Mhm. Good.
Okay. Well, thank you very much. If let's just give it a one more minute. If any question, Cindy, you
I
have a
have one
question?
more.
Yeah.
This does you guys do work with the younger group, like middle schoolers even, if they call.
Yes, we're happy to.
Okay,
We also have a text line if the young people would rather text us. They can
Okay.
respond. That's different than the 988.
okay.
So we have our own text line program that I can, make sure you know about.
Okay.
Mm.
Maybe I can give a follow-up email with all these resources.
Okay. That'd be cool.
Yeah. Right here, found the text line.
Because I know suicide hotline had one, so I didn't know if
Mhm.
about texting because younger people will text more.
Yeah. Well, what we found was we had a hypothesis that as the years go on, more and more people would text and not call us. But the answer is no, our call volume
No? Oh,
continues to
okay.
grow. And now we have a whole cohort of people who are able to
Okay.
call us. So yeah, what we want to do is just create more avenues for people to reach us.
Mhm.
Did you list what that was? I don't see it. The text
Yeah.
line.
It's there's a link there, and then there is a
Oh, I
to
didn't
access
scroll.
it. Yeah, you use one word safe to get the conversation started, and the
Okay.
phone number is this 5-digit code 20121.
Okay, I didn't scroll down enough was the problem.
Oh, in the chat, yeah. I'm wondering if I can drop a link also to a survey about this presentation.
Sure.
It'll take you 2 minutes to fill out, and it's a survey about what you got out of the presentation and some demographic information. Everything is voluntary, and you could even ignore the survey if you'd like. But it helps me get feedback on how to make this better. Like, I truly believe like we are creating this together. So like your questions, your feedback, your comments, your experience, we'll try to incorporate it in our protocols and our procedures. Truly, like, we are here to serve you.
Thank you. Thank you very
Thank
much.
you.
We will take that seriously, and thank you for your time, and hopefully we'll get back next year. We'll chit chat to see where the program goes. Go ahead, Marcia, you want to say something?
Okay, I just want to let everyone know that Mr. Binh Au is going to be one of our primary speakers at the suicide prevention workshop for family caregivers. And he'll be speaking in the morning on suicide prevention theory and practice. And then in the afternoon, he's going to teach us communication and what to say to your loved one who is actively suicidal or having serious thoughts. So we, I know I even though I've heard you speak on this, I'm extremely excited to see you again, and I'll be hosting. So hopefully I'll be more organized this year. So
No, you're great. Yeah, it's always lovely to be in community with all of you.
Marcia, can you remind the date for everyone's benefit in case?
August 13th. I've already put in the chat, registration is required. So I have put a link in. If not, go to our website on our front page. We have all the information, NAMI-trivalley.org. And we hope you can come, even if it's just a drop in and listen to particular presentations. We'll be putting the agenda on by the end online by the end of the week. So hope to see you there.
Thank you. We end on the good note, and we end with that. We would like to have always a venue to invite you back. So everyone here, member or not, come one, come all, bring friends and guests, come back to the all-day training. And I'm sure at some point over there, you'll hear about 988, right? Because that's extended training. So thank you, Binh. Thank you, everyone. you know where to get hold of us when you need to. Okay? You
Thank
have a
you.
great evening. Thanks.
Yeah, good night.
Good night.